We're back. I'm here with Sue Rosa. She is part of the Chelmsford Board of Health. She is the Public Health Director.
Yes.
We appreciate you coming on.
Thank you. I appreciate being here.
I see as part of your title that you have a BSN RN, so you're a nurse?
Yes.
Oh, that's
yes.
excellent.
So I've actually been with the Board of Health for, it'll be 18 years in January, so I was the manager of healthcare services for quite a while before I took the role as health director.
Oh, wow, excellent. Do you like the new role? or?
It's a challenge.
Okay.
It's not boring, I will say. It's very interesting. There's something different all the time.
That's awesome. So I know you guys are running some clinics. Why don't you talk a little bit about what you guys are doing at the Board of Health?
So as you said at the beginning of your show, we're having our town-wide flu clinic this Thursday. This is actually our second one. We did one in October. We do one in November. So this Thursday, November 1st, it's held at the Senior Center. It's from 4 to 7, and we vaccinate anybody from the age of 3 and above. And we do ask that people bring their insurance cards with them, because what we do is we do bill for the cost of the vaccine as well as an administration fee. And this allows us to just kind of rotate every year and buy more vaccine. So we do have vaccine also specified for people that are 65 and older. It's referred to as the high-dose vaccine. And I get a lot of questions in my office. People call often and they say, well, what's the difference between high dose and what they refer to as regular? So the high dose vaccine designated for people 65 and older actually has 4 times the antigen in it than the other vaccine. So there's trivalent, which is 3 strains, and then quadrivalent, 4 strains. And what that does is by having 4 times the antigen, it provides about a 24% increase in coverage against the flu. And people who are 65 and older are at a much higher risk for not only getting the flu, but the complications from the flu, such as pneumonia, which is the #1 complication for getting the flu. Obviously, as the Board of Health Director and a public health nurse, we really want to encourage anybody who is of age to get the flu. It's actually recommended for anybody over the age of 6 months. Those that are between 6 months and 3 years have to get it at their pediatrician's office, and publicly we do 3 years and above.
Wow.
So we do have the different formulations available. And I can't stress enough for people to get the vaccine. CDC last flu season saw 80,000 Americans die of the flu. And I don't think people realize the impact that the flu can have. In Massachusetts alone last year, we had about just under 23,000 cases of flu. Chelmsford had 208 confirmed cases, and when I say confirmed, that is they were hospitalized or tested, and then that was sent into the state, and we get those numbers from the state. So there's probably a lot more than that. It's just that those were the confirmed cases. I also like to talk about the fact that you cannot get the flu from getting a flu shot. That is a total myth. There is no live vaccine. There's no live component to the flu shot. However, it does take about 2 weeks to gain the immunity that you need from getting a flu shot. So I try to tell people to plan ahead. We've already had 1 confirmed case in Chelmsford so far, which this is the early side. Last year we peaked in about February, but flu season actually runs from October right up till May, which is a pretty long season. And even if you get your vaccine in October, it does cover you through the entire flu season. And the other thing I always like to stress whenever I get a chance to educate people about the flu and getting a flu shot and preventing the flu is it is so important to wash your hands and cover your nose and your mouth when you sneeze. And even people don't realize that even when you're talking, if you have the flu, that the flu is spread through droplets. And this always amazed me. I remember seeing a video one time, and I think a lot of people have probably seen it over the years, as to when you cough or sneeze, just how far those droplets are projected. And one sneeze, because you think about when you sneeze, it starts at the back of your throat, and sneezes are pretty powerful, okay? And you can actually spread about 40,000 droplets with one sneeze.
Wow.
At rocketing speeds. And so if you're the person that I happen to be talking to and I'm brewing the flu virus and I just don't cover my nose when I sneeze, and of course you don't do it with your hands and then shake someone's hand, you do the whole elbow, I'm spreading that virus, and it can stay alive for, a significant amount of time outside the body. So I always like to try to stress, wash your hands often, cover your cough, cover your sneeze with your elbow, not your hands. And if you're sick, if you have flu symptoms, don't share them with the people you work with. Stay home.
Well, one thing that comes to the top of my mind is smartphones these days, because a lot of people, like, if you're sick, you may wash your hands, but then like you sneeze or whatever, and it somehow gets on your phone. But then you're like playing with your phone. It's like, I really feel like that's really a conductor of a lot of germs during the flu season. So clear your phone with a little bit of like Lysol wipe or something. And
right. Carry the little bottles of hand sanitizer. They're tiny enough that, most women could throw it in their purse, but even for a man, they have the little bottles. You could easily throw it in your pocket and just use it throughout the day. The cell phones, like you say. And I actually read an article just recently, and it said not only should the person that is sneezing or coughing cover their mouth, but if you're the one in the line of fire, you should cover your own as well. I thought that's a good idea.
That is a good idea. My wife's a nurse, so these little bottles of Purell start to pop up everywhere.
Yes. I think I have one everywhere you turn.
It's hard though. I've got 4 kids, so everybody's going to different events and all sorts of stuff, and so you never know kind of how things are coming into the household. And
exactly. I raised 4 children myself, so I can definitely relate to that. And the difficulty too is one child could be brewing the flu virus, and they could be infecting other people within the family before they even have the symptoms. So that's difficult too. Oftentimes you can be exposed and it can take 5 to 7 days before you start developing symptoms. So who knows how many people you've contaminated. So during the winter months, when flu is more rampant, I just say, wash your hands, use the sanitizer, cover your mouth, and try to get enough rest, drink enough fluids, eat healthy to try to prevent yourself from getting the flu. Senior citizens are at a much higher risk of complications from the flu. So we also try to teach people that if you have an elderly relative and you're not feeling well, don't grace them with your presence, because they may not be able to fight it off as easily as you can. And the same with small children. They're also at higher risk from the complications from the flu as well.
Yeah, you definitely don't want to go in sneezing on the newborn.
No, no. And if you have a newborn in your house or young children, there's definitely something to be said about, you as a parent getting vaccinated, the grandparents, the babysitters, everybody being vaccinated, because there is a lot to be said about herd immunity. And basically what that means is there's a certain amount of people in our population that always say, well, I've never gotten the flu shot and I have no intention of getting the flu shot. And they may never get a flu shot. But if more of a majority of people do get the flu shot, then that herd immunity against the flu can cut down on the numbers, because even those people who don't get the vaccine, they can spread it, but if other people have been vaccinated, we can protect them.
Now, those 3 strands, those cover a majority of the flu virus that's out there, or are there multiple strands that still exist? Or?
So there's still multiple strains, and the 2 types of vaccine, they refer to one as the trivalent and the other as the quadrivalent. So the trivalent basically has 3 flu virus strains in it. The other has 4. And the difference is the trivalent would have 2 A types and 1 B. The A is usually the predominant flu virus that circulates. Last year it was one of the predominant ones that caused the majority of the illness. And then for the quadrivalent, they put 2A and 2B. So the Bs are not as prevalent as the As, but they do provide those in the vaccine so that there is some protection. And it's not a perfect match every year. And people say, well, if it's somewhat of a match or if it's close, you do get the protection. If it's a total mismatch, then obviously even if you get the vaccine, you're not getting protection.
Right.
But they're usually pretty close And there's been a few years, as you well know, in the past where it's been a total mismatch and people say, wow, they were way off target. But
Yeah.
for the most part, they do a pretty good job with matching what they predict is the.
So do they actually have to pay for the shot, or is it covered by insurance?
So for our public clinics,
Yeah.
it's covered by insurance.
Okay.
And we get a very limited amount of state-supplied vaccine that we don't have to pay for. We only get, actually, the only thing we get from the state is flu mist, which they designate more for children.
Okay.
But there are limitations to who can receive flu mist. You can't get it if you're above the age of 49, and you also can't get it if you have any kind of respiratory illness because of the way that it's manufactured. But we do not deny anybody that comes to the public clinic a flu shot,
Okay.
because we'd rather see more people get it, and we'll take a hit as far as cost if we need to, just to get people immunized.
That's excellent. All right, so what day can they go again? And
This Thursday, November 1st, it's at the Senior Center, which is 75 Groton Road in North Chelmsford, and 4 to 7 p.m. We open the doors at 4 o'clock, and we'll be there up till 7.
Awesome. You going to be there?
I'll be there, and we have my public health nurse comes, and then we get volunteers for the medical reserve course. So we have between 8 and 10 nurses giving shots at any given time. So even though it might look like a long line, it moves very quickly.
Awesome.
So
Well, we appreciate everything you do with the Board of Health, and we appreciate you coming on and promoting it.
I appreciate you having me. Thank you very much.
Awesome. Thank you.
Thank you.